everyone, Dr. Mirisse Foroughe, Chief Psychologist at Family Psychology Center. And today's question comes from a parent who's asking, why would a parent or caregiver be involved in a child's treatment? So this is a great question. And I think many parents wonder if they should provide information or somehow be in touch. And sometimes when your child starts therapy, you know that they need a safe space to talk on their own, but then as the process continues on, it might feel like you're really on the outside, and it might feel like you have important information that now there's no way for you to share because they're in this relationship with a therapist that is private and confidential. So it's good to have this conversation right up front with your child's therapist before getting started. And there's three main considerations that we think are important. The first one is that parents often have a perspective that's very different than a child's. So it's really important to hear your perspective and to know it. You might have background information. You might know about stressors that the child doesn't even know are going on in the family. And of course, information about how you're doing, how other family members are doing. And all of this can give us a whole wealth of information that's very difficult for a child to necessarily share or know. So your perspective is very important, and you know your child best. The second reason is that a lot of children learn strategies and approaches in therapy that they then need to practice and implement at home. And if parents are not part of the process, they don't know what those are. They can't support them. They can't make them possible. And sometimes they can even do something that will kind of go against the strategy that the child is trying to implement. For example, if a child learns to relax and take a break and try to calm themselves down if a conversation is getting heated, they might be taught to walk away from that conversation and go in their room and practice a relaxation strategy. Now, if you don't know that that's happening as a parent, you might feel like you're being disrespected, that the child is just walking away in the middle of a conversation. You might follow them, and that can, of course, lead to greater conflict. So knowing what your child is being told to do and is coming around to learning to do is very important so that you can be part of their success. And the third reason that we would consider is that a lot of times parents feel like they're on the outside and they're the ones living with their child, trying to support their child day in, day out. You're ultimately responsible for your child's well-being, and you deserve support. You deserve to be part of the process and to have support for yourself. Whether that's going to be a few parent coaching sessions alongside your child's treatment, or to be involved in the treatment process in a more central way. It's important to help parents too, because you're the most important people in your child's life. So that would be our thoughts on why parents should be involved in a child's treatment process. And we think it's most important to have this conversation with your therapist right from the beginning so that you can put some agreements in place that your child feels comfortable with and that the therapist feels comfortable with, as well as yourself as a parent. Bye for now.